Um, we came up with this workshop because we felt it was important to voice out the transgender population's identity in a way that we can really help to define a lot of you know identities. So what we have heard a lot is that LGBTQ plus is part of it's part of the same umbrella. But what we find is that, and what our persons have expressed, as well as our peers, is that the T within the LGBTQ plus has subdivisions of LG and so on. So we really wanted to clarify what a lot of that looks like, and we're gonna do it through here. Hope you enjoy. So to begin, I'd like to say who we are. The TEACH project stands for Testing Education Access to Community Health. TEACH is a peer-driven disease prevention health promotion program, specifically for young gay, bisexual men and transgender youth, 18 to 24. The overall goal is to reduce the risk for HIV, viral hepatitis, and other STIs, and reduce or eliminate the onset of substance use disorders. The project incorporates sexual health education, HIV, viral hepatitis, STI testing. We provide support services aimed at reducing youth's risk of infectious diseases. We inform them of their health status, and afford them the opportunity to reduce the risk of through peer-supported behavior change. So the TEACH project collaborates. We work in conjunction with the ATOM project, which stands for Alcohol Drug Advocacy for Men. Now, ATOM is the treatment and recovery supplement to the TEACH's prevention program. So ATOM delivers substance use disorder counseling and case management services for young men who have sex with men, 18 to 29. And we use outreach and street outreach, as well as social media, to engage and maximize the project services. And of course, Miss Mallory, we did this presentation in collaboration with the LGBTQ Center of Long Beach. And the Center of Long Beach, they provide mental health services, youth programs, HIV and STI testing, cultural programs, and social and support groups. So for today's workshop, these are our 5 objectives. Number 1, learn how to assess and not assume when working with the transgender community. Educate and empower participants to use risk and harm reduction alternatives. Teach how to implement client-centered strategies. Number 4, overemphasize with participants to follow up. And 5, familiarize participants with trends, cultural norms, and language. And before we begin, we wanted to start off with a quote from Wendell Glenn, Dr. Wendell Glenn, which is trans pride, people who are real with individual and divine equality. Dr. Wendell Glenn, he's the coordinator of the ATOM project. And here we will begin with talking about a few statistics regarding transgender individuals. Okay, and to begin with, 90% of transgender individuals who are reported have reported experiencing harassment, mistreatment, or discrimination on a job. And I know Gracie can elaborate a little bit on that.
Yes, so one of our persons served what she mentioned about, she works in the fast food industry. So her being a cashier, she experienced how a person that came in, and tried to place their order, she waited till another cashier took her order, and she told her, it was a female as well, and she addressed to her, I don't want you to take my order. I want someone else to place my order. So yes, it does actually happen in the same workplace, and it could be the same sex orientation. And unfortunately, there is discrimination in the workplace.
40% of transgender individuals are unemployed. 32% of states that include gender identity protections in their non-discrimination laws. So there are very few protections to help transgender individuals. And I know things will get better.
And for that one, recently, due to the COVID-19, there were a lot of people that got laid off. And I would say about, well, for my case, I had to help 3 of our persons serve because aside from being discriminated because of their gender identity, it's also their background, where they come from. So, they stated, aside from being an undocumented fellow, that's what they stated, I also have to worry about my orientation. So do I actually have a case? So I had to look for an attorney to help them, because aside from that, they got laid off and they didn't get paid. Mm-hmm. So everybody else in the workplace got paid except for these 3 persons served. So that itself, it is discrimination because everybody else got paid except for them. And luckily they did have a case and we were able to help them.
All right. 90% of voters incorrectly believe that there are already federal laws protecting transgender individuals from being fired. And right here, we're gonna go over mental health concerns. 39% transgender individuals reported having experienced serious psychological distress, compared to 5% of the general population. 40% reported having attempted suicide, compared to 4.6% of general population. 7% have attempted within the past year, compared to 0.6% of general population. And just as a side note, going to the 40%, going to bullying, transgender students have a greater number of students that are bullied. So it's I know that that's the highest number of students getting bullied, the transgender population. So 33% reported having at least one negative experience with a healthcare provider because they're a transgender. And I know we have a few incidents due to COVID-19. Right, Gracie?
Yes, actually, we collaborate with many agencies, also healthcare providers, even law enforcement officers, and we have been informed how, going back to the suicide attempts, how most of them are successful. A lot of the individuals that come through the ER is due to attempted suicide. Also, I've seen, as far as the negative experiences, are alcohol intoxication or even an overdose as well. And another is, not seeing a doctor, where it talks about 23% not seeing a doctor that they need because of fear of mistreatment or because of their being trans. Going back to the crisis that we're at right now, that a lot of clinics are closed, a lot of dentist offices are closed. So we have to find clinics, dentist office that are LGBTQ friendly, because honestly, not everyone works with the, I would say, nicely with the LGBTQ community. So we had to do our homework and help these persons serve find those clinics, because most of them need to get tested. They start having doubts with their partners. So I just rather be safe and get tested and know my status. Yes.
Right. We've heard many stories as why it's important to be seen by a professional, a healthcare provider that you actually feel a connection with. We've heard stories from some of our persons served going in to get seen, and once they disclose their status and so forth, they see a change in the provider's affect. So we try to help our persons served to not we do research. For that reason, we have peer support groups, and in which peers can help each other with those situations. So here we're gonna go into what does it mean to be transgender. So generally, someone who does not identify with their gender assigned at birth. And some identities that can be under the trans umbrella are non-binary, genderqueer, gender non-conforming, demigenders, two-spirit, trans women, and trans men. And right here, we're gonna have our first pop quiz. The question is, what are indicators that someone is transgender? So, Minor.
I'll hand that to you, Minor.
Yes.
So, oh, Sasha, yeah, I love Sasha Velour. But so to answer this question, please feel free to type it in the chat, or feel free to raise your hand if you want to speak directly to the presenters. And I'll be looking at the chat to see any responses, and I'll let y'all know. Okay, so Alexander Franco says, well, first of all, I love Sasha Velour. And then Alexandra Franco, to respond to the question, says, they tell you. Giovanna says, when they tell me that they are. Elena says, I think the only way to know is if someone tells you and identifies that they are transgender. And Jessica Morales says, I agree with Giovanna. Rose Zapata says, people will bring it up themselves. Edwina says, I have no idea.
Those are great answers, guys. And we're actually going to cover some of those answers later on too.
Yeah.
Berenice says, I don't like to assume, so I always wait for them to let me know if they are comfortable doing so. Chanthi says cross-dresser. Rosa de la Cruz says appearance. Nicole says, I think avoiding assumption and just letting them tell you is the best.
Okay.
Nice answers.
Perfect.
We'll give it another minute.
Maritza says, I wait when they let me know.
Good answers, guys.
Yeah.
Jeanette says appearance, but I don't like to assume. So honestly, it's hard to know.
Good.
Okay.
Adrian,
Go ahead.
Okay.
Adrian says, male build and features with female clothing.
Okay.
Let's see, guys.
So, let's see. What are some indicators that someone is transgender? Now, we're going to go over a few things of, I guess, what not to do, which, of course, is to judge by appearance and by dressing. Voice inflection, you know, noticing someone's voice and assuming behaviors and body movements, makeup, which restroom they use. So these could have been some of the answers that, you know, someone might have put in their name, their pronouns, what someone else is telling you about them. So the answer is the only way you know is if someone tells you they are. And the reason for that is it goes back to our previous slide, which people identify in different ways. And the reason for that is there's a word that is hard for me to say, but we're gonna go over right now. It's due to cis-centric
Cis-centric norms.
Yes. So we'll go over that. So gender identity development. Gender identity development usually starts between the ages of 3 to 5. There's outward expression of gender, which can be based on environmental factors. So support from home for non-ciscentric identities means introducing the idea of different identities, such as that we covered, such as gender nonconformist, and so forth. So there are quite a few different type identities. So and the thing is that messages about gender are received from various outlets, such as media and school, which goes back to this term. They are cis-centric, and that means that, you know, in the educational system, there's boy and girl, and that confuses our children when they are discovering who they are.
And some of the times it starts as early as when one's gonna have the baby, you know, when they're like, oh, you know, gender reveal, or we're already choosing the colors, and, you know, the infant's not even born yet. So they're like, oh, it's gonna be a boy. So first thing, when it's a boy, it's blue. It has to be blue. Or, oh, it's gonna be a girl, and it's pink, you know? So, you know, there's where it says, you know, support at home. Yes, but already at home, in some cases, they're already choosing for the child. So, you know, as they start growing up and start developing, and they're seeing that their child that is a boy is wearing a skirt or wearing a dress, it's not okay. You know, they're already telling them that is not okay, you know? So that's like Ray mentioned, like the confusion starts there because they might not be comfortable wearing those jeans. They would rather wear a dress or they rather wear a skirt, things like that. Yeah.
Right. So support starts at home. And these are some risk factors if a child is not well supported, through at home or school and so forth. Some general risks are they are 6 times as likely to experience depression, bullying. As I said, it's very high. Substance misuse, they're 3 times as likely. 8 times as likely to attempt suicide. 40% for homelessness to occur down the line. There's pregnancy. There are cases where someone might get pregnant just to kind of prove that they're not who they believe they are inside, and down the line that leads to other factors. Sex work, juvenile justice system, absenteeism, and lower academic aspirations. Like I mentioned, then if someone gets bullied at school, of course you're going to focus more on you're going to be on more on survival mode rather than what's my next homework assignment, and focus on that. So some variables to the risk are socioeconomic, family, culture, religion, and peer support. So transgender colleagues, what to know? So privacy. In terms of privacy, transgender employees do not have to disclose that they are transgender. Coworkers, supervisors should not ask if an individual is transgender. And, and all medical things should be kept in private. Coming out, an employee has the right to choose whether or not to come out in the workplace. Changes to accommodations upon disclosure should be handled with consideration of transgender employees' comfortability. Respectful and accepting environment. So consider your own bias. Would you say that to a colleague who was not transgender? Think about that. Transgender employees should not be considered the agency experts in transgender issues. So to refrain to consistently ask for so what we do need in the workplace would be LGBTQ competency workshops, rather than
and adding to that, in the workplace, we as professionals need to be careful. Well, he or she is transgender, so they know it all. So let's let them take over the workshops. They're going to be able to do a better workshop than someone that is not transgender. And it not always work that way, because some of the times there could be different issues, and some of the issues that the person server may bring in or the client may bring in could be triggering even for the coworker. Yes. Him or herself. Yes. So in that area, yes, one needs to be careful. And again, going back to one of the objectives, not to assume, that they know it all. Yes.
Right. And because everyone is in their own in a different part of their journey, and so we can't just assume. Dress code. So California state law explicitly prohibits an employer from denying an employee the right to dress in a manner suitable for that employee's gender identity. Best practice is to eliminate dress code policies based on gender. And then sex segregated job assignments. AB 196 does not prohibit an employer from making job assignments based on sex, so long as those assignments are otherwise in compliance with state law. However, in most cases, transgender employees must be qualified and assigned in a manner consistent with their gender identity. So here are a few more laws. The anti-discrimination policy, name and pronouns, California Code of Civil Procedure, section 1279.5. Entails employee records and identification documents should be changed accordingly. Intentionally addressing a coworker or employee by the incorrect name or pronoun after having been informed of that person's gender identity is an accountable form of discrimination. So it can mean, what this means is that you might meet a person with certain pronouns at intake, when you meet, and it can be that they later on, they identify differently. So we have to be mindful of where they're at in their change.
And that goes, on following up with your person serve. I personally went through one experience that at intake, the person serve, identified herself as male rather than female, and at exit, same thing. But it went to the last session, the follow-up, they're like, you know what, guess what, this is who I truly am, So when Ray talks about like meet them where they're at, it's a process, and I know we talked about substance misuse, alcohol intoxication. This person served went from drinking 30 days, using substance 30 days, to cold turkey, 0 at follow-up, they reported. Because it took that phase, it took those individual sessions, those group sessions to, like she stated, to find herself, who she was. And thanks to that, she was able to process and discover who she truly was. So now she's back in school. She doesn't use drugs. She doesn't use alcohol, and she's happy as it can be. She even has her own apartment on herself, all by herself. So she went from having food stamps, from having welfare, to having a stable job on campus and having her own apartment. So yes, it's a process. Yeah.
All right. Restroom accessibility. All employees have a right to safe and appropriate restroom facilities. This includes the right to use a restroom that corresponds to the employee's gender identity, regardless of the employee's sex assigned at birth. Where possible, an employer should provide an easily accessible, unisex, single-stall bathroom for use by any employee who desires increased privacy. Now, right here, we go to our poll question. Right. So the poll question is, which of the following statements should you not do when a person comes out to you as transgender?
Just let me know when you want me to close the poll.
Okay. So far we have 44 to 69, so we're almost there.
Mhm. Mm. 15 more seconds. Okay.
Okay.
All right. So here it is. So it seems 25% people say that thanking the person for telling you they are transgender is a statement you should not do. 6% believe that if if someone comes out to you as transgender, you ask them if they need support. 6%. Be prepared to give resources. 4%. And 67% of the participants say that saying that I knew it, maybe you shouldn't tell anybody else, or I never would have known is something that you should not say. So we're gonna go into that right here. So these are the do's. If a person comes out to you as transgender, do thank the person for telling you. They took the courage of telling you, and this is a really important step. Do be a model of acceptance. Do ask if they need support. Be prepared to give resources and gather information. Ask them, who else knows? Can I share this information? Because maybe their comfortability is different with you than it is with others. So the don't is, don't say, I knew it. Or maybe you shouldn't tell anyone else, because that's saying like, maybe you shouldn't tell somebody else. Like if they're like, it's something wrong.
You're putting doubt in that person by telling them you shouldn't tell anyone else, because you're putting doubt in that person.
Right.
And that's one thing that it actually harms them as far as the stage of trying to give them support. And going back to the person so that I stated, if I would have had told her, oh, maybe you shouldn't tell someone else, I doubt that the results would have happened the way that they came out about, by me not addressing her and telling her, well, maybe you shouldn't tell anyone else.
Right. And we will be having a workshop pretty soon about coming out. So just putting it out there. And the last thing to not say, or one of the last things to not say, is I never would have known. So supporting trans clients, social versus medical transition. So the state of their transition is a person's choice to disclose. The privacy, do not disclose anyone's identity unless given permission. So this includes the parents. If a child lets you know they are transgender, a minor, I should say. Sometimes telling the parents it entails a different set of situations. So that has to be we have to be aware of this. Name, regardless of legal documents, role sheets, it is imperative to use the name a person asserts, how they identify. Pronouns, respect pronouns. and access to safe facilities. So access to safe facilities such as restrooms. Service provider expectations for cultural humility. So educate yourself, listen to your client or person served. However, be aware that your client is not responsible to educate you. We have to go out of our own way to learn this information. Respect boundaries. Avoid asking questions pertaining to someone's old self. So you cannot say something like, well, remember when you identified as this, you know, such and such. That's not appropriate. Remember that although someone's gender is a large part of their identity, it is not the only defining feature. Not every client may feel the need to discuss their gender identity, nor how it relates to others.
And adding to that, you know, going back to the person server client not educating you, we have addressed this before, and I like to mention it right now. Some of the times the person served might not be comfortable disclosing to you. They might, so at first intake or at first approach that you have with your client or person served, it's best to say, there are other co-workers here that can assist you. So if you don't feel comfortable me asking you questions, you know, we have, for example, in this situation, if you feel more comfortable talking to Ray, Miss Mallory, or even Miss Alexis, it'll be a lot easier for them, you know, because you're giving them more options. You're just not like closing, because some of the times that's how they feel. They feel intimidated. Well, I have to answer to her, or I have to answer to him, you know. So by that sense, the way that I see where it says, you know, not responsible to educate is in that sense that, hey, I don't feel comfortable talking to you. You know, I'd rather talk to someone else. You should give me that option of talking to someone else.
And we have to understand that one transgender person's experience does not represent another transgender person's experience. So intersectionality. It is important to recognize and see youth as a whole person, not just by one type of identity. So right here, talk about it. Recognize that youth with multiple marginalized identities can face multiple forms of oppression. So while a person might be experiencing at school bullying due to their gender identity, they think about their nationality. You know, if they come from a background in which their nationality is suffering at school due to language barriers and so forth. Let's think about that. Let's think about racial identity, sexuality. So like how we were saying, gender identity and sexuality are two different things. While someone might identify as transgender, their sexual preferences might be, you know, so male to female, for example, a male that transitions to female, that person might be interested, you know, they might identify as gay, they might identify as bi, lesbian, and so forth. So let's keep that into consideration. Disability, if someone has a mental health disability, let's think about all those things.
You know, and in that graph that you guys see here, I actually can share something from our person served about their gender identity, you know, their nationality and their disability. We have a person served personally that, aside from trying to discover himself, whom he was, they were diagnosed under the spectrum, and also recently with personality disorder. So not only was this person served going through finding himself and also going through being an undocumented person served and finding their sexual preference. So it's a whole component, like Ray said, there's different things that they have to be addressed. So we have to go pieces by pieces of the puzzle to put everything together and be able to give better support and better resources for this person served. So as a whole, there's so many things around it. Yes, the main focus is to help, but like in this case, how should you start? This person served is not only going through substance, this person served is not going through mental health, but also to discover who he is. And on top of that, their sexual preference and facial identity. I mean, there's so many components that, in the trans community should be addressed and should be known. It's not only one thing that they should focus in. It's just like pieces of puzzles and just bring them all together.
So social transition. Some types of changes that might occur during social transition are coming out, the change of a name, changing their names, change of the type of clothing, change of pronouns, a haircut, binding, breast forms, packing, tucking, and of course, legal documents. Medical transitions are some gender-affirming medical interventions that individuals might seek are hormone, top surgery, double incision or peri-areolar, bottom surgery, hysterectomy, pallostomy, phalloplasty, metoidioplasty, facial feminization, tracheal shave, breast implants, bottom surgery, so vaginoplasty, orchiectomy. So this is our next pop quiz. Can you name what are some gender-affirming medical interventions that individuals might seek?
Let's see if you guys remember. I know that Ray went a little bit fast, so let's see if you guys remember.
No, I struggled with the pronouncing a few as well.
So Minor, can you open that for us, please?
Yeah, of course. So feel free to raise your hand or put it in the chat. So Elena says HRT. Chantel says, can you explain some of the terms? Crystal says top surgery. Maggie says top surgery.
Right. Well, yes, of course. We went over hormones and so top surgery, it can be, putting breast implants or removing a breast tissue. And there is also a few, facial changes that one can do, and so much more. Bottom surgery, so removing of organs, and so for example here, bottom surgery for a vaginoplasty, orchiectomy. I know they are medical terms, so I would say look up those terms. That way you can know what the medical procedure is. But each one of these has a different, they have different stages and they have different components in them. And I know we're like running out of time, so yes. But those are really good questions, really good answers. we wanted to also go here, creating an affirmative environment. So signage, first impressions to decrease heterocentrism. So in our facilities these are really important to infuse client spaces with LGBTQ affirmative reading materials and resources. Gender neutral restrooms, rainbow symbols, trans flag symbols, non-discrimination policies, LGBTQ magazines in the waiting room. At our facility, we have plenty, not just one, but many. Policies, so non-discrimination policies, like we mentioned, the restrooms. Documentation, use affirming and gender expansive language on all paperwork. Ask about gender and sex assigned at birth. Expand on relationship status. Do not presume limited to dyadic relationships. And we're coming to our end, which is creating affirmative spaces. It is important for us to create these affirmative spaces by communicating with patients. Ask all clients or persons served about pronouns, sexual identity, and gender identity. Don't assume pronouns or identities from heteronormative and ciscentric bias. Record information with confidentiality and respect clients' wishes. If you make an error, respond with respect. By that is if you accidentally say someone's pronouns wrong or something like that, do it with respect. Advocacy for LGBTQ resources and understand about gender affirming medical interventions and know these resources. So keep LGBTQ affirmative lists for all types of referrals. So right here we have our contact information. This is Miss Mallory Robinson. She works at the LGBTQ Center of Long Beach. This is her contact information. This is our location, the Adam and Teach warehouse, in case you're interested, in the center's location.
Thank you.
Yeah. And our last slide, these are a few resources that you might want to consider. And that is all.
Thank you. So at this time, we'll be taking any questions. So please feel free to raise your hand or type them in the chat. Oh, okay. So Joan says, thank you for the presentation. How many states have laws protecting transgender folks? Laws similar to what California has, intentionally calling someone out their name/pronoun counts as discrimination at your workplace, or are there varying degrees of protection in each state? How many states have no protection laws whatsoever?
As far as the exact number, I don't personally have that number. We do have that information, just not with us at the moment. Because yes, different states do have different laws, different variations. So,
But if you can provide us your email, we'll definitely get back to you, or you can even email us and we'll definitely email you back with that information. Yes.
yes, here are our contact information.
Nice. And it looks like Maggie has her hand up. If you want to unmute.
I was actually going to respond to Joan. There's actually an organization that does, it's a website called lgbtmap.org, and they'll have like a state-by-state breakdown. I can put it in the chat.
Oh, thank you.
Thank you.
Are there any other questions that we have for our presenters? Okay, well, you have their emails. If you happen to have any questions, feel free to reach out to them. Ray, if you can stop sharing your screen, please. And we will wrap up today's workshop. So, So we want to give our thanks to Gracie, Ray, and Mallory. I guess she wasn't able to join us, but you did get a lot of thank yous in the chat. But if you all can use your reactions and let's clap
Thank
it
you,
up.
everyone.
Thank you. Thanks.
Minor, if you can help send out, maybe you did already, the post-test and evaluation link. If you can, there we go. Thank you, Minor. That's how you get your CUs and certificates of completion. And if you have any questions, please send them to Jen Harris at southbayprevention@gmail.com. And Jen, I'm going to have you take over for this slide.
Yes. So I just put a file in the chat box, and it is this exact slide. So we wanted to talk about what's next. So Minor mentioned earlier that we are, next week will be our last set of workshops for this round of Growing Prevention Online Workshop Series. And we want to let you all know what's coming up next if you're interested in participating or even want to share with folks. So we've been talking about how we're going to have repeat workshops. So the repeat workshops will be scheduled for the first 2 weeks of June, from June 1st through the 12th. We will be selecting 10 workshops that will be repeated, and those workshops will be repeated based on your votes. So we need you to go to tinyurl.com BHS repeat and vote on which 10 workshops you would like to see repeated. Just for clarification, the workshops happening this week and next week will not be on the list because we are rolling out the voting today. Additionally, we're going to be having skills building workshops from June 15th through the 30th in the evening. We will make sure everyone gets more information as it becomes available. We're going to focus on several different things. Some topics include employment, around creating a resume, cover letters, finding a job, also goal setting, leadership development, and so many other topics that we are currently in the process of developing. So if you know folks who'd be interested or could use the information, we want them to be present because we know that as things start opening up, more folks will be out, and we want to make sure they're prepared to take over the world. And lastly, we are going to be having agency roundtables. So these are going to be virtual agency roundtables, and we are really excited about this. We're going to be having them every Tuesday and Thursday from 10 a.m. to 11:30 a.m. in the month of June. Just a little bit, just a description. So we'll have 2 presenters each meeting. They will each be able to present for 15 minutes apiece. We'll also have an opportunity for anyone who is on to share any opportunities or resources that are available for folks so that we can make sure everyone who's on, we're sharing these resources. And additionally, everyone who's participating will have the opportunity to talk about any challenges or any needs that they may have within their organizations or agencies. So this will be a great space, a positive space, and we hope that everyone will join us. We have signups to present, so the link is also on the slide that you received and also what you're looking at now. This will be sent out via email as well, so folks will know where they can go to sign up. So we will keep you posted on everything, and I'm going to turn it back over to Tosin and Minor. Thank you.
Thanks, Jen.
Hey, Jen.
We have a lot of great things coming up. Just stay tuned. And like she said, you'll get an email with the links and everything. So So just to see what we have coming up this week, it is National Prevention Week. Unfortunately, all the trainings for this week are closed already, but we do have problem gambling disorder tomorrow, human trafficking and CSEC for service providers, vaping, smoking cessation, and COVID-19. And then on Friday, there's mindfulness. So if you are interested in week 6, the registration will close on Thursday. But we have a lot of great workshops coming up, as you can see. So please sign up once you get those links and all that info. And thank you again for joining us today. We appreciate it. And have a great rest of the day.
I'm sorry, can I add one more thing? I left off a workshop. I apologize. We will be having drug trends, which was scheduled on April 23rd. It is now scheduled for May 18th at 10 a.m. So the monitoring teen stress and anxiety during COVID-19 steps for alcohol prevention is actually scheduled for 2 p.m. So we'll have 2 workshops that day, and I'll make sure the slides for tomorrow are corrected. Thanks again, everyone. And our presenters have selected a closing out song.
Thanks, everyone.
Thank you, everyone.
I've had my share.